Hello everyone, my name is Dr. Tejas Hambir and I am consultant neonatologist and pediatrician at Rainbow Children's Hospital, Secunderabad. Today I would be enlightening doubts surrounding an important topic, that is, how can working mothers continue or support breastfeeding after resuming work. It is recommended that all babies should be exclusively breastfed till 6 months of age. But having said that, it doesn't mean that they should not be continued to breastfed after that. If mother has good enough milk, she can continue breastfeeding beyond 6 months along with complementary feeding. Many mothers doubt whether they should shift over to formula feed after they resume work. The answer to that is a big no. So how do they proceed ahead? Today we will be giving you few tips regarding same. Tip number 1. Start early and set up a schedule. The first step to successfully combining breastfeeding and working takes place during the first 4 weeks after your baby is born, a time when you are setting up a feeding schedule and establishing your milk supply. If a woman gives herself and her baby 4 weeks of quiet nursing time, that is, without talking on phone, working on computer or in any way being distracted, then she will not only be settling up a definite feeding pattern, but she will set up a strong bond between herself and the baby. Tip number 2. Learn to express breast milk and preferably use a breast pump. Breast milk production is a supply and demand process. The more the baby nurses or you stimulate your breast with hand expression or pumping, the more milk you will produce. Each woman's working schedule and situation will be different, including time availability and accommodation for pumping and storage of milk. Hand expression of breast milk can be time consuming as well as tiring. A good breast pump, either manual or electrical, can help in expressing milk better. Usually, glass bottles are recommended over plastic bottles to store milk. Once expressed, you can store milk by refrigerating or freezing it. Remember, expressed breast milk can be stored for 4 hours in room air, 24 hours in a refrigerator, and 3 months in freezer. To warm milk, place bottle in a glass of hot water or run hot water over the bottle until the milk is no longer chilled. Do not warm milk in microwave. Tip number 3. Train yourself and your baby. To get your baby in a habit of having expressed milk via a bottle, practice by giving it for 1 or 2 times daily at least 1 to 2 weeks before resuming work. Talk with your baby care providers about how to store milk, rewarm it, sterilization of bottles, and your baby's individual feeding cues and needs. It is very important for them to understand. Tip number 4. Talk to your manager. Apart from training your baby, talk to your manager about having flexible work timings. Mention that you would need breaks to either pump milk in a private room at office, or will need to feed the baby if baby is at on-site daycare, or will need to go home to breastfeed the baby if home is nearby. Tip number 5. Get all the help you need. Continuing breastfeeding while at work is not an easy task and definitely exhausting. So try to get help from your family members and friends. It is good to join breastfeeding support groups where you can share experiences and challenges faced while balancing work and baby care with other mothers and experts.